actually want to ask you two challenging questions, and these are actually posed by people in the community. And one of the questions was, are you worried at all about supply chains and potentially shortages of drugs, including biologics?
Yeah, and it's a great question, and so everything that all the information that we have from the companies that make these drugs suggests that there's going to be no issue with supply chain with any of the biologic therapies and or the present immunosuppressants that we're using, whether it be azathioprine or methotrexate. So I don't want patients out there to be concerned if this goes on for even a year, right? You're still going to have access to therapy. So don't worry about that. The drugs will get to you, and so that should be less of a concern for any of our patients.
Okay, good. And then the second challenging question I have for you is that a number of our patients are on infusions and they go to infusion centers in Canada. I just wanted to get your sense of what they should be doing in the context of an infusion center.
Yeah, and so that's another good question. So it sort of dovetails into, should you be going to your infusion to get your the infusion center to go and get your medication? The answer is absolutely yes. I think that there's been efforts with leadership, IBD leadership throughout the country to have dialogue with the sort of companies that run these infusion centers to make sure that they're following the same sort of advice that is being put forward by public health officials and that we've talked about today. So what you will see is that you now get a call ahead of time to screen you for your symptoms. So if you have symptoms, they probably will reschedule your infusion, because we don't want people to go into an infusion center if they possibly have symptoms that are consistent with COVID-19. Because of the social distancing issue, many of the infusion centers will be decreasing the number of chairs that they have so that they can spread those out. And so that may lead again to a little bit of scheduling differences. And so I think that people on this call, and I think CCC has an interest in this as well, and we have an interest as physicians for you as patients to make sure that we're interacting with those entities to make sure that possibly we have national guidelines on how to keep you safe within that infusion environment.
Thank you. And the one thing I just want to let all the people in the audience who are on infusions know is that everything that Remo was saying is happening, and they're trying to do everything they can to meet the social distancing requirements laid out already throughout this conversation. But what that might mean is fewer infusions happening at any given hour, which means you really have to work with them around potentially being rescheduled about different times. There maybe you have to go a bit earlier, a bit later. Like these are challenging times, and everyone's working towards this solution. And it just is so important just to be patient. And we recognize that, people, their kids are in school, so a nurse might not be able to come to work, things like that. They may be understaffed if somebody gets isolated. So just please work really closely with your infusion centers, and you may need some rescheduling just to understand why this is happening.
And Gil, sorry, can I just make one more point? And I think that this is important for patients. So I know we're sending a very, very clear message that you should be on your drugs and get them on schedule, et cetera. But that doesn't supersede if you are sick, right, and you have symptoms that may be compatible with COVID, sort of the viral infection. Please do not go to your infusion and sort of say, no, I'm fine, et cetera, because what that may play out as is you now go, you're in contact with the nurse or nurses, you're in contact with other individuals. And what we can't afford to have across the country is for infusion centers to start shutting down, right? Because then we're left with, where are we going to sort of infuse these drugs? So again, play your part. If you have symptoms, right? Delaying for most patients, delaying maybe 1 or 2 weeks where we get through that incubation period that we just talked about is probably more prudent than showing up with minor symptoms and then ending up having COVID and having an infusion center shut down.